So, good afternoon, everybody. All right, let's try one more time. Good afternoon, everybody. That's it. Now we're alert. Now we're ready. Ready to learn. Okay, so I want to thank everybody for coming to the first day here of Dr. Weiner Wellness Week. Winter Fall Fiesta. Okay? So some of you, I know this is the first time. Is there anybody else here for the first time? Other than yourself? Anybody else? You? Okay, welcome. So we have these events normally every couple months, but this is our longest stretch until the next one due to the weather. Okay, so the next event won't be till the first week of March. So 3 months away. So you want to factor that, into your supplements to make sure you take advantage of these extreme discounts, which truly are extreme. Okay, so just a little brief introduction about myself. My name is Mike Gallagher. I'm a certified lifestyle educator. Okay, I'm not a doctor. I just like to say I educate the doctors. Okay, I've been in the nutritional industry for almost 20 years, and I'm only here during these events, wellness events, to help answer questions. If you have any health issues, try to help you out as best I can, okay? But I'm here during these events to try to do these presentations. It's one of the main reasons why I am here, to help further your education and really show you the science behind these ingredients, behind these conditions, how we really truly can help with all different types of health issues if you use the right ingredients and reduce stress, eat the right foods, and exercise. We can have some truly miraculous benefits and results. So I'd like to welcome everybody. So we're going to talk about brain health and mood. So this is a very big topic. There's a lot of issues here to discuss. And we've made some changes recently, some improvements on some of our formulas. So we've already had really good results with and what we did to make them even better on this. Okay, so we've come out with a new Brain Boost. It's now called Brain Boost 2. We'll talk about that here in a moment. We also improved our Neuromax liquid drink. So we'll talk about that. We have a new coconut oil, flaxseed oil combination called Cocoa Flax. We'll explain where that fits in. Fish oil is good for every single organ in your body, as well as not only your brain. We do have a tincture option if you prefer liquids. Calm days as well for your mood and anxiety and depression, mood lift. Okay, so these are our main brain formulas, shall we say. So we'll break all these down here in a moment. But first of all, let's talk about the aging, okay? The brain is always aging just like the rest of our bodies. And unfortunately, neurodegenerative diseases are on the rise. Alzheimer's, dementia, Parkinson's, AOS, Lou Gehrig's syndrome, all are increasing, especially in the last 10 to 20 years. And we'll talk about statistically here in a second, Alzheimer's in detail. But every brain is aging, okay, just like the rest of our bodies. So we talk about all different types of health issues, and all of them have their role, all of them have their benefit. But the number one organ system is your brain. Because at the end of the day, if we can't think clearly, if we can't speak clearly or function properly, it doesn't matter if you have stomach issues. It doesn't matter if you have joint pain. It doesn't matter if you have candida, if your brain isn't functioning. So your brain should always be the number one organ system. And everybody should do something to help your brain every single day. So it should be thought as basic preventative. Of course, we want to be proactive instead of reactive. So we want to keep that in mind. We talk a lot about everything else, but the brain should always be number one. All right, so let's talk a little bit about Alzheimer's. Here from scary statistics here. Usually things start happening around age 65, although we are starting to see younger and younger cases of Alzheimer's now. In 2006, there were 26 million documented cases of Alzheimer's worldwide. They're predicting if current trends continue by 2050, 1 in 85 people will have Alzheimer's, which is pretty scary to think about. Now, the first sign of this, first red flag, is forgetting names, numbers, right? Keys, glasses, cell phones. So everybody has those moments, everybody has those days, but if it becomes habitual, if it becomes an everyday occurrence that you are forgetting things, this is really the first sign. Now, of course, if we get into more situations, advanced situations, you go through all different phases, all different situations here, confusion. Some people are irritable, some people more aggressive, some people more depressed and withdrawn. So again, not everybody fits into every single one of those issues, but again, if it is an everyday occurrence that you're forgetting things, that should be a first red sign of what's going on here. Now, with Alzheimer's, we don't know exactly what the cause is. There's a lot of different theories. There's plaquing involved, neurofibular tangles are involved. And why these occur is really, the mystery, but there's a lot of variables going on here. So we know there is a genetic predisposition to 1 to 5% of cases. So if you have any family history, your mom or dad's family have Alzheimer's or dementia, that should be a concern. There's a connection with herpes simplex virus 1. Oxidative stress, inflammation also play a role. And then we get into the medication aspect, statins. When we are lowering the good cholesterol, which the statins do, our brain is over 70% good fat. As statins have increased in our society, so has dementia and Alzheimer's. So that it can be a huge connection. There's a blood sugar connection, okay, with diabetes. There's also cardiovascular connection with blood pressure and strokes and and smoking all play a role. So these are some of your more common variables going on. And when we see an MRI scan, physically what's happening to the brain with dementia and Alzheimer's, there's a healthy brain, there is an actual Alzheimer's brain. It's literally eating away at its core, which is pretty scary to think about. So of course, we always want to be preventative. So here are some tips. We always want to stay physically and mentally alert. And again, this is a problem for older people after they retire. They become more sedentary. They don't become that brain. They basically turn off. So we always recommend board games and exercises that helps your brain, keeps your brain developed. Of all the diets, number one diet for prevention is Mediterranean diet, which is our core diet that we follow. Light to moderate alcohol use, 1 to 2 drinks, especially red wine. Okay, 1 to 2 drinks, not 1 to 2 bottles. So more is not always better. Now, if we flip it, diets high in fat and calories are associated with increased risk of Alzheimer's. Okay, the wrong kind of fats. So the fat connection. Of all the proteins, diets high in fish, especially wild fish, has been associated with decreased risk. And of course, then we get into the whole heavy metal aspect, and especially aluminum. And aluminum now is so prominent, it's hidden in a lot of our foods that people might not realize. So we listed them here. Certain grains, chocolates, chocolate pudding, American cheese, salt, chewing gum, all have some traces of aluminum in it as a preservative. And then the cookware. People cooking with aluminum pots, cooking with aluminum foil. You should never do that. You should never drink out of aluminum cans because some of that will get into your body. And there's some in antiperspirants and vaccinations. So it's not just one thing, it's a multitude of different issues that we add up here causing this serious brain issue, okay? So when we do a test, we have a test here called a Cyrus machine that tests for all heavy metals, all minerals, and all antioxidants in seconds. And people who have dementia and Alzheimer problems and memory issues, aluminum is always the number one that pops up the most as far as heavy metals. Mercury number 2, lead number 3, okay? And we can help get these minerals out of your body. We'd especially recommend doing a detox, which for us is our greens, our Live Clear 2 and shakes. But it takes about 4 months to get these minerals out of your system. So it is a process here. All right, so can we help with these memory issues? Yes, we can. So we took an already really good formula, Brain Boost, and we combined it with another formula of ours, IQity. And we combined the two together into this new formula. So that's basically what this is designed about, Brain Boost 2. And so listening to a lot of doctors out there that we work with, you know, they basically told us, we really like some of the ingredients you have in the original Brain Boost, and we like some of the ingredients in the IQity. And if you combine those two together, and then you added a few other ingredients that they were using separately, this would make a very powerful formula and get even greater results with this. Now, I can tell you, I've had at least 10 different occasions here at this Winder Wellness Week where people have asked me, you know, my mom or dad has dementia, they have Alzheimer's, is there anything that you can suggest? And I would tell them the Brain Boost. I would tell them. And then I would see them again 2 months later. And they would they would come up to me and they said, Mike, I can't believe this. My mom and dad is improving. I would hear the words dramatic improvement, miraculous, doctors can't believe it. At least 10 different times I've heard this since we had this formula. 10 different times. There is a naturopath that I work with, another one of my accounts. His mom is 94. She's had dementia Alzheimer's for the last 2 years. She's taken Brain Boost, and she is improving at 94. Everyone else on her floor, doing terrible. So we've had a lot of anecdotal reports with this formula. So we know the Brain Boost works if you take it properly. But think of this as just everyday memory issues, not the worst kind of situation, not dementia, not Alzheimer's. But again, if anywhere you're trying to remember names, retain information, if you're getting ready for a test, for high school kids, for finals, college kids, so forth, this will really work within 2 to 4 weeks for most people, this formula, Brain Boost 2. That's how short or soon you should recognize it. So I'm just going to pass that out for you. We'll break this down here in a second. The main function of this is focusing on this neurotransmitter, acetylcholine. And this is the main one associated with memory loss. And the lower this is, the more you have these type of memory, dementia, Alzheimer issues. So we're just trying to raise it up naturally, safely, without any side effects. Dosage on this is even easier than the previous formulas. 3 capsules, all taken at night. 3 at night, 90 cap bottle, we're talking about here. Okay? So what's in it that makes it so special? So one of the main ingredients is this one, phosphatidylserine. Okay? All these have research to help with dementia and Alzheimer's and memory. But phosphatidylserine is one of the main ingredients that will actually raise acetylcholine, that neurotransmitter. 99% of the phosphatidylserine on the market is from soy. This is not. It's from safflower oil. So that's very unique. We're also using the 4th generation folic acid called quadrifolic acid, which even helps on the methylation aspect of it. 3rd main ingredient, phosphatidylserine. And phosphatidylserine, again, there's actually been proven research for the elderly to help with memory. Very, very unique that it actually focused on that particular segment. Can even help with athletics. There's research on this, may help with Alzheimer's, may help with depression, may help with Parkinson's. And a lot of supplement companies just sell this one ingredient by itself. This is in this formula. Fourth ingredient, acetyl-L-carnitine. So this is an amino acid. And at high doses, it has been shown that it can help with memory, dementia, and Alzheimer's. 3 different published studies, we listed them there, has been shown to help with just that one ingredient. Fifth ingredient, ginkgo. Ginkgo has been used for centuries. Look at this stat right here, folks. In Europe, ginkgo is actually approved as a treatment for early stage Alzheimer's, and it's been shown to help in just 6 to 8 weeks just using ginkgo. Okay? 3 different published studies confirm that. So that also is in this formula. Fifth ingredient, ginseng. Ginseng helps on the adrenal end. So there's a tie-in with your adrenals and memory. So we have that in there. And then these were the 2 main ingredients that we took out of the IQD. One is called bacopa. Bacopa is an Ayurvedic herb. It's been used for centuries. And there is studies on this for memory, for concentration. And the other ingredient we added was vinpocetine. Vinpocetine is very unique. Again, there are studies on age-related memory, but also for stroke recovery, also for incontinence, vertigo, so dizziness, and also retinopathy. There's also even newer research on vinpocetine for tinnitus, ear ringing. So if you have that issue, this also might help, because we normally recommend ginkgo. Now that we have the vinpocetine and ginkgo all in one, so that's another area where you could see benefit with this formula. And then last ingredient we have in this is huperzine. Again, very unique. This ingredient inhibits this enzyme. And this enzyme is actually what degrades acetylcholine. So if you have an ingredient or nutrient that stops or inhibits that neurotransmitter acetylcholine from getting worse, and you have all the other ingredients raising acetylcholine, you can see how this formula can really do some incredible things. Make sense to everybody? Okay? So you add it all up, put it all together, and that is this new formula. Very excited to have this available now. And dosage is only 3 a night. Like I said, the reason I didn't mention it is phosphatidylserine works on cortisol levels better at nighttime. So that's why we would dose this at night. So either with food or right after food, okay, with this formula. But we are able to not only make it stronger, but also use less, and also it's a much better price. So we tried to improve this in every way, shape, or form. Okay, so for most memory issues, 2 to 4 weeks, you should definitely notice 1 bottle. If you have dementia, Alzheimer's, we're looking at 2 to 3 months. For those serious cases, there's no drug contraindications with any drug other than Coumadin. Coumadin is the only one that we would be cautious about or concerned about. Okay? Before I move on, is there any questions on this? Does that make sense? Okay. Next, we do have a tincture option if you prefer, if you don't want to do capsules. It's called Neurotincture. Okay? So it's a Chinese herbal tincture. It's all herbals. We would recommend 2 droppers full twice a day with water is the dosage on this. If you have dementia, Alzheimer's, we would bump it up to 3 droppers twice a day. Next, Neuromax. So the Neuromax is a liquid drink. Tastes like black cherry cough syrup. We've had great results with this. Basically, the main ingredients is DMG, dimethylglycine, one of my favorite ingredients, betaine hydrochloric acid, magnesium, and zinc. We also added or improved this recently by adding a different type of B12 called hydroxycobalamin. And hydroxycobalamin has been shown for especially be beneficial for people who are attention deficit, obsessive compulsive disorder, or anybody on the autism spectrum, we would recommend this formula for. This is great for kids, and even on the directions, ages 4 and up, you can take this formula, 4 and up. The other great thing about this is that if somebody is trying to get off antidepressants or anxiety drugs, you can take this, and it will really help minimize basically getting off those type of drugs. Okay? So it's very unique in that mechanism, how this works. Dosage is just how old you are, right on the bottle. Tastes like black cherry cough syrup. I would just recommend that to refrigerate it once you open it. Okay. Yes?
What's the difference between that and Calm Day?
Well, I'll get to Calm Day here in a second. It's different ingredients, but I will answer that question. Now, this is also something else that we've come out with recently, a coconut oil, flaxseed oil combination. So this is unique, and we would recommend this over fish oil for a couple areas. Can you take this with fish oil? Yes, you can. But if you were to choose one over the other, this is where I would recommend cocoa flax. I would recommend, first of all, if you're a vegetarian or a vegan, you don't want to do fish oil. That's pretty obvious. But secondly, for cholesterol, if we're trying to raise good cholesterol, HDL, coconut oil has been shown to be the best oil to do this. So that's one area where we would recommend this for, raising HDL. Second would be for any brain issue. So it would be complementary to the Brain Boost, or be complementary to Neuromax, to Calm Day, to Sleep Time, to anything that anxiety, depression, sleep issues. It would be the better choice over fish oil. Okay? Coconut oil is very neuroprotective. Yes? You can take both. Absolutely take both. But if you, yes, if you had a concussion, and I'll go over concussions here at the end, I promise. But yes, we would recommend both if you've had a concussion. Also, because this is flaxseed oil as well as coconut oil, great for the skin. So great for dry skin, which is usually more in the wintertime. But also acne, eczema, and psoriasis. Which leads me to my next area where we would recommend this for candida. So one of the other properties of coconut oil is antifungal. Now, would it be our #1 supplement for candida? No. Candy Kill would be our #1, SBC would be 2, so that's the core program. But if we're going to do an oil, cocoa flax would be a better choice over fish oil if you have candida fungal issues. Okay? So those are the areas that we recommend it for. Again, it's very unique because it has both coconut oil and flaxseed oil together. You've not seen this anywhere else in the supplement industry in a soft gel. Comes in a 60 soft gel size. For any of these issues, we recommend 4 a day, 2 in the morning, 2 at night. And then once the condition's under control, we back it down to 1 in the morning, 1 at night on the cocoa flax. Okay? Start with 4 and then back it down to 2. How long? Again, tip 2 and 2 until the symptoms have improved. What's that?
Does the cocoa flax also have the anti-inflammatory properties when you take the regular treatment?
No. It doesn't have the inflammation aspects as fish oil. So fish oil would be for any other pain issue or inflammation issue. That's where fish oil really has been shown to be the most benefits. Pain and any other inflammatory issue. Ours is called omega-3D. Per pill, it's one of the strongest amounts of EPA DHA that you can get. Plus, it also has vitamin D added to it as well. Okay, so per pill, it's $7.80 guaranteed. We've gone through all different types of testing and lab testing to make sure, including the international standard testing that we can have on that. Okay. Mood. Depression. We know there's lots of different reasons, lots of different aspects and variables going on. There's the emotional aspect, of course, hormones, these different neurotransmitters that we're talking about, not only this one, acetylcholine, but serotonin and dopamine and GABA. Blood sugar plays a role. Of course, your diet, lifestyle, stress, exercise. Again, all play a role. So there's lots of different things that are in the mix here when it comes to this. Our main focus, what we're trying to do with all these type of supplements, is focus on these neurotransmitters, which are the messenger signals to the brain from one cell to the other, okay? And they're basically either there's a gap or synapses that's not happening here. So the two main ones, as I said, serotonin and dopamine are your two biggies. They all help with sleep. Serotonin also with pain control as well, inflammation. Dopamine also helps with memory, learning, and your pleasure center there as well. Okay, so calm day. If we're focusing on more anxiety issues, stress, sleep as well, that's where the calm day would fit in. Okay? Calm day we've had great results with. This is very unique. Again, think of this as, you know, the everyday situation, and you have all these stressful moments, right? So this basically just levels everything out, just calms and relaxes you, but keeps you focused without making you sleepy. But when you do go to sleep, it helps reset your sleep cycle. We start with 1 in the morning and 1 at night. If you don't notice the difference, then bump it up to 2 and 2. Okay? It's very unique ingredients. The first one being the most unique ingredient, this long-sounding name, 4-amino-3-phenylbutyric acid, which is basically a precursor to GABA. It passes through your blood-brain barrier, and it rebalances serotonin, dopamine, and GABA. It has some aminos, and it has your B vitamins, B5, and B6. But that is how we would dose this. The one caution with this is you can use this if you're on an antidepressant. We would just not use this if you're on an anxiety drug known as your benzodiazepines. So that's your Xanax, that's your Klonopin, those type of drugs, Valium, okay? Those you're known to classified as your benzodiazepines. So you can use Calm Day if you're on antidepressants, not just the benzos. If you're on those medications, we recommend just straight L-theanine. L-theanine has a very calming, relaxing effect. We would recommend 3 a day unless you have an anxiety attack, then we would take 2 at once. Usually works within 15 minutes. If you don't notice the difference, then take 2 more. But that's how we would dose this, and that's how you get the best effects. Will not interact with your benzodiazepines. Okay, so that's a little bit more detailed on that phenibut, that first ingredient I was talking about. So it's just different ingredients than what's in the Neuromax. Neuromax is DMG and betaine hydrochloric acid and magnesium and zinc. This is a little bit more detailed, more specific on serotonin and dopamine. So could you do both? Yes, you could do both. They just work on different mechanisms of action there.
But they do the same thing.
Yeah. In the end, yes, yes. But I would recommend Neuromax more for ADD, OCD, and autism. Okay. Or if you're trying to get off those drugs. All right. Lastly, the mood lift. So the mood lift would be for depression. Okay. So if you have depression issues, that's where we would recommend this. It's very unique. It has tryptophan, 5-HTP is tryptophan, ginkgo, your Bs, and magnesium. Dosage is 4 a day, 2 in the morning, 2 at night. The one caution with this, we would not recommend this if you already are on an antidepressant, or antidepressant pill or an anxiety pill. So we would like to try this before you start an antidepressant, or if you finish off an antidepressant, that's how we would dose this. Okay? All right, lastly, I wanted to leave a couple protocols for people. So if this isn't you, but you might know somebody who has these issues, very important. So first of all, concussions. Concussions. We've been asked this many times. What do you recommend for this? We've had great success with this protocol. There's a clinic south of here that we work with, and they deal with professional athletes as well as high school kids, as well as anybody in between. But temporary is the key. Temporary aggressive supplements. Once the condition's under control, then we back down the dose. Okay, so Mad Complete would be our first choice, 8 a day in divided doses, so 4 in the morning, 4 at night. Omega-3D or cocoa flax, or really we recommend both. So the ideal situation would be 2 in the morning, 2 at night for either one. 2 and 2 in the morning and 2 and 2 in the evening. And Power Q600, 2 a day. 1 in the morning, 1 at night. If they have traumatic brain injury or post-traumatic stress disorder, then we would bump this up to, we add pregnenolone. Pregnenolone has been shown to help specifically with these more serious brain injuries, bumping it up to 4 a day, increasing it slowly. All right, next, migraines. Migraines, cluster headaches. Our number one approach is magnesium complete, 4 a day. Mag complete, 2 in the morning, 2 at night. If for a female, if you're getting these during your menstrual cycle, we would add Estro Cleanse, 3 a day. Usually you will notice a difference within a day or so. It's not an aspirin. It's not going to work as fast as an aspirin, but it's going to really help prevent any additional headaches or migraines from happening. If you don't notice a difference after just one bottle, then we would recommend a liver detox program. So there it is right there, 10-day or 30-day. We have the booklets in the back on this, which is our shakes, Live Clear 2, and greens. And that should definitely help with the migraine situation. But Mag Complete usually works 9 times out of 10. Couple more here. Parkinson's. We get asked a lot about this as well. Our number one would be Power Q600, 4 a day. This is high dose CoQ10 along with that DMG, 300 milligrams of each per chewable. So 4 days what the research has shown on Parkinson's. Okay, 1,200 milligrams of CoQ10. First stages of Parkinson's has showed slowing it down by 44%. There's no drug in the world that's shown that kind of results as CoQ10. We would also add cocoa flax or omega-3D 4 a day, 2 in the morning, 2 at night. And on our website, a couple wellness events ago, we actually interviewed a woman here that we know. She's had Parkinson's for, I believe, 18 years now. 18 years, she does not have one single symptom of Parkinson's. And she's only taken 2 things supplemental-wise in her life, CoQ10 and DMG. And she doesn't have one single symptom. Now you think about the 2 most famous people right now with Parkinson's, Muhammad Ali, Michael J. Fox. All the money in the world, the best care in the world, whatever they're doing is not working. Here's a woman, very limited resource. She's only done 1 thing or 2 things, CoQ10 and DMG, which is what Power Q600 is. No symptoms whatsoever. This is on our website. We videotaped her in an interview here, right here at the Weiner Wellness Week. You can go through nutritionalfrontiers.com and check out this testimonial, or you can go through YouTube. So YouTube, Nutritional Frontiers, Parkinson's, and you can see this testimonial. But it's a very 10-minute interview. You can see clearly she does not have one single symptom. It's very powerful to show somebody who has Parkinson's this video, okay? The earlier we catch it, the better off we can help them with Parkinson's. And lastly, we kind of talked about this already, but just to review. If a person is bipolar, or if they're on antidepressants or anxiety drugs, this is the total protocol we would recommend while they're on the medications if they're trying to get off the medications. Okay? Neuromax we talked about. If you don't want to do a liquid, we have just the Enter DMG just by itself, chewable as another option. Super B Complete, 2 a day. And there's the cocoa flax or omega-3D, 4 a day, 2 in the morning, 2 at night. If you can only afford or do 1 thing, it would be the Neuromax. Okay? But if you do all 3, it will really help minimize when you're trying to get off these drugs. The other thing I always talk about with someone is, if they're on antidepressants or anxiety drugs and they're trying to get off, and a lot of them have this fear of talking to your medical doctor about this, your prescribing physician. They feel very intimidated. They hate seeing it. It causes more stress and anxiety. So a lot of times, most cases, you don't have to even make an appointment. You can just call the doctor's office and speak to the office manager, okay, or the nurse practitioner, and just tell them over the phone that you'd like to get off these drugs. And they will tell you right off the phone how to titrate slowly off the medications, 9 times out of 10. So most people don't know that. Most people think you have to make an appointment with your medical doctor, but that's not always the case. So I always say try that first. But this can really help minimize those issues, which a lot of people get headaches, nauseousness, and so forth. Basically, they're detoxing when they're coming off these drugs. So this can really help reduce those kind of effects. Okay, so there's all the options for you. Hopefully they make sense. Whatever one you think would work best for you. Hopefully you understand where each one fits. We've also updated that brain and mood brochure, so if you want to just take that out for a second. Again, on the back page, all the different options we recommend, exercise options, relaxation, and sleep techniques. And then there are the updated new formulas, the Brain Boost 2, the Neuromax, and the Mood Lift, and the food aspects, things we want to try to eat every day, moderation, and things we want to avoid as well. Okay, so our time is up. Any questions before we take off? Yeah.
Actually, two. The PowerQ600, I take the powder. Is that different from the CoQ10 and the DMG together?
Powder. You take so PowerQ 600 only comes in a chewable. You take the Power Fuel.
Yeah.
Okay, so that's a totally separate formula.
Oh, it is.
Totally separate. Yeah, PowerQ 600 is a chewable. We have it in it's 2 sizes, the 30 or 60. No, Power Fuel's a little bit different. That works more cellular energy and for your heart is where that works.
Okay, now.
There is a little bit of CoQ10 in there, but not as much as the PowerQ 600.
As far as the brain boost, when I took the phosphatidylserine by itself,
Yep.
I took that a while. I didn't see much of a change.
Yeah.
Then I switched to the brain boost. I took that.
Yeah.
And I did notice a change. I noticed it's changing. The one thing I want to ask you about is, I get like sensations, I call it in my brain.
Yeah.
Is that something that would go along with that? Something's going on and that you feel like twinges and stuff?
Again, I can't answer that for sure. I don't know why that might be happening, but the point is that you did see an improvement
Oh, yeah.
after how short a period of time?
Well, since the last,
2 months.
yeah.
2 months ago, the Brain Boost. Yeah, I don't know if something's something's recharging in there. So little electrical stimulation in the brain, which that could be possible. But as long as you feel a difference and notice the difference, memory's improving. Yeah.
Fogginess is gone and I can start remembering things that I did
Yeah.
before.
Yeah.
They're like coming back.
That's great. We hear that, like I said, quite often with the Brain Boost. So on that. Any other questions at all? Yes.
What about the place you said that you send people that still have a concussion?
Yeah, come see me afterward. It's a clinic that I work with south of Pittsburgh. Okay? Any other place else or any other questions? All right, folks, we have about an hour here. We close at 5 today. So again, if any of these look good, everything's discounted. So hopefully you give them an opportunity. I do have extra copies, so if you have any family members or neighbors or friends that weren't able to come, please grab a couple extra copies for them. All right, thank you so much. My time is up.